Okay, guys, if we're being honest, a lot of us avoid going to the doctor unless we absolutely have to. A study by the Cleveland Clinic found nearly 2/3 of men say they put it off as long as possible. The problem with that, of course, is that it can keep doctors from detecting issues early that might have been prevented in the first place, or could even save our lives. So that's why we're teaming up this year with Franciscan Health for a campaign called Real Men Wear Gowns. We're going to be highlighting some top concerns when it comes to men's health, hearing from the experts, and hopefully motivating you to put that medical gown on. Go see the doctor. And what better way to kick that off in the new year, a time of course, to make resolutions to better ourselves. Family medicine Dr. Omar Acevedo joins me now to talk about making health a priority. Dr. Acevedo, thank you so much for being here.
Thanks a lot for having me. I appreciate it.
So in your experience, why do so many men neglect their health? Why do we seem to put it off until we absolutely have to go?
Yeah, that's a good question. I feel it's like there's a cultural aspect around it. I think men, like, we're made to feel that if we don't feel bad, then why go to the doctor, right? The main issue, though, is that if we wait until we feel bad, sometimes there's some medical issues that when you're feeling bad, they can't be fixed. It's too late. You know, that's why it's important, as you're mentioning, you know, to see the doctor. You know, a lot of times it might be too late.
So I know that everybody's different, obviously, but if you could narrow it down to maybe 3 things men should do to make health a priority this year, what would those things be?
Okay, so 3 things, nice and simple, is diet, exercise, and make sure you see your doctor. So, so for diet, there's this kind of stigma around having to eat healthy. So if you eat sweets, it's like you're bad. You're doing really bad things for your health. So the main issue is that it's not like eating bad foods. It's how often you eat them. If you're making a habit out of eating them, you know, eating your favorite sweet every once in a while is okay. Eating them every day is very different. So that's something I can mention. Eat a lot of vegetables, especially green vegetables.
Okay.
Is good.
And exercise. If I'm not exercising right now, say I'm not doing anything physical, what's a good starting place?
Okay, so a good starting place is to be more physically active. So if you're the kind of person that you're all day on the couch watching TV, stand up, do a few laps around the house, move. Like, there's actually studies that say that people that are more physically active are less likely to have depression and memory issues such as dementia. Just physical activity. I'm not saying for you to have to walk, you know, for miles at a time. Any physical activity is better than none.
Literally a few steps can help.
Yes.
That survey I mentioned from the Cleveland Clinic shows 72% of respondents said they would rather be doing household chores, cleaning toilets, than going to the doctor. 20% admitted they aren't always honest with their doctor about their health.
That's also true.
Okay, so you're not surprised by this?
Yeah, you know, especially when you mentioned maybe not being honest with doctors. I mean, hey, that can also be an individual thing. You know, you need to find a doctor that works for you, that you feel comfortable with, and that should also help you be honest. And really, like, doctors, like, we're here to help you. So whatever you tell us, even if you feel it might be like embarrassing or not, like, we're here to help you.
That's a good point. I have a lot of friends and family members who have been looking for a primary care provider. Maybe they move into a new community, and that can be a difficult thing, but it sounds like just because somebody's available doesn't necessarily mean they're the right doctor for you.
Right. I mean, a primary care doctor will be your doctor, hopefully, for life. So it should be somebody that you really trust and that you feel comfortable with. In the end, it's your health.
And why is that primary care doctor so important? Why not just see a specialist when you need to see a specialist here and there?
Yeah, because as primary care doctors, it's our job to make sure that we catch things early, that we prevent you from getting sick. My job is to help you stay healthy. And if you already have issues, prevent those issues from kind of getting worse.
We mentioned a few minutes ago that those 3 goals for men in the new year, health goals. The third one was see the doctor. Is that a see them as soon as possible? Is it an annual physical? What do you recommend?
I mean, hey, just like the exercise, it's better doing something than nothing at all, right? You know, if you can aim to see your doctor at least once a year. At least that will help the doctor give some nice care, okay? But if the doctor wants to see you sooner, then probably it's because we're trying to catch things early. Again, monitor how your health is doing. But hey, at least going is better than nothing, right?
Yeah, absolutely. What can you say finally? What's the pitch you can make to men to shift their way of thinking on this?
So, I mean, it's your health. Just aim to see your doctor, even if at least once. Just start. Just take a start. See your doctor at least once, and then see how it goes.
Okay. Anything else we should know or that you would like to add?
No, just in the end, I believe that a good health it will also lead you to a happier life. When your health goes really bad, you might end up in the hospital, and nobody wants to ever be at a hospital. So that's the essence of good health: staying out of the hospital and being happy. Yeah.
All right. Well, we look forward to talking with you a lot more this year. Your experiences, your stories, and encouraging people to be healthy. Dr. Omar Acevedo with Franciscan Health, thank you so much for joining us.
Absolutely. Thanks for having me.
We'll see you next time.
Thank you.